Hi everyone, my name is Mario Maroni and I'm an Italian physiotherapist. I studied in Italy, but I work for almost 6 years in the UK now. I'm also expert in other kind of approaches. They are all manual approach. I strongly believe that your pain not necessarily come from the painful area, so just forget about lower back pain coming from the lower back, neck pain coming from the neck, or shoulder pain coming from the shoulder. I want to give you some example and why you should remove your attention from the painful spot. In my extensive training, my teacher always told me one important thing: never touch the pain, because the pain is an inflammation. There is something going on there for sure, but we need to understand why. I give you an example. Let's say today you are a 40 years old guy who is having a desk job based work. You walk from home to your workplace and you experience pain from the lower back, which come out of nowhere. No direct injury, no operation, no car accident, no major trauma. Let's say that 20 years before, you had a fracture on your left ankle. Now, you may think it's not related. You need to remove your attention from the pain, because that ankle that 20 years ago has been fractured, it will never work as before anymore. But there is more. It's not only a mechanical problem. Lots of people understand you have a mechanical problem on the left, you compensate, you put more pressure on the right, but it's not only there. Because the ankle has a specific innervation, which is located around the lumbosacral area, that part on the left side, it will never move anymore. So the pelvis will twist. If you lie down on your back, and if you try to lift the pelvis on the left, it won't move as the right. That will show you many things. First, there is a local trauma. The trauma, to be honest, is on the foot, but it made an immediate restriction and nerve irritation on the spine. So first, from the spine, you can tell where are the injury that patient had in the past. Why the actual pain is there. Why you can have a pain on the lumbar spine from this? Because the pelvis is twisted, the spine is twisted as well. So if you touch the paraspinal muscle, which are on the side of the spine, you touch this part and you touch the opposite one, you will feel a great difference. The twist of the spine, your spine is always twisted. If you have a pain on the spine, your spine is twisted. Then, over the year, may give you the disc problem, the arthritis, the nerve compression that may end up in a sciatica, more likely on the other side, for example. Because the other side will move more, it will be dislocated, and you can have a nerve impingement on the other side. So you need to understand very basic and simple rule. First, a treatment needs to have a starting point and a end point, okay? So if you're doing something to manage your condition, but you need to continue to do it. If you stop, the pain return, you're not really sorting out things. Also, if you had a treatment course of session and you feel better, then you wait 6 months, 1 year, and the pain returns, same location, usually worse. On the first instance, not a lot had happened. Okay? Why? First of all, in the previous case, I would treat the ankle. I wouldn't treat the spine. But by treating the ankle, I expect a release and I expect that the muscle they start working properly. So imagine for 20 years, your paraspinal muscle are working this way, they get inflamed over the time. For no reason, apparently no reason, you start having pain on the lumbar spine. It's more understandable if I talk about a foot injury and a lumbar spine pain, but if you have a wrist injury, can you have a lumbar spine pain as well? It's even more frequent, okay? Because the fracture or the injury or the operation on the arm, sometimes just overdoing. Imagine someone who play box or someone who do rock climbing. They have a lot of injury on the forearm. They don't know, but if they do test, they will feel that one side and the other, they work completely different. It's not important what happened here, but here needs a treatment, this part needs a treatment. It's important, the neck. The neck will never bend on the right anymore. It will be twisted, and this twist will be transmitted immediately to every part of the body. So there is more chance that from a neck sensitization, how we call it, you may end up having pain on the lumbar spine. So it's not important where is the pain. That's why I like chronic condition. I like to work with chronic patients because they think, oh, I tried everything, nothing worked for me, I need to go for an operation. If you go for an operation for a lumbar spine pain, why sometimes it works? Because the operation is an injury itself. So with the operation, that part of the spine, it will get stuck. It won't move anymore. So you cannot trigger the pain. Is a solution? Well, it's a medical solution. Is a solution for me? I like to understand what's going on and where the pain comes from. So I will never do something like that unless you tried everything. Believe me, there is always room for improvement. Okay? So forget that an operation will change your life, because the operation then will cause another injury on the lumbar spine. You don't feel the pain on the lumbar spine, but then after a while you feel pain somewhere else because there will be a misalignment coming from the operation. So the operation will, especially on the spine, it will be a massive event that will change your life. Okay? The doctor tend to go on the spot. The doctor tend to believe you. So today, they can even diagnose you by telephone because they believe in your ability to picture the things. You always report what you think is relevant. You will never report to me that you had a fracture on an ankle 20 years before. Okay, I will ask you. I will anyway find out. Even if you don't tell me, I will find out because I will do manual test. I will do mobility test on the spine. So what I will find, let's say you have nothing except for this fracture on the left foot. If I do here, if I put my hand here and I try to lift your pelvis from you lying on your back, that part, it will never move. So you will be surprised of what is the lack of knowledge that you have from your body. No one knows these things. No one cares. But why? Because you don't find information on Google. So people nowadays believe that on Google you may find every kind of information. So you just put the spot, you have a tennis elbow. I never in my career treated a tennis or golfer elbow pain on the elbow. Never. Not even once. Okay? Unless you have an injury, you have a fracture, but the fracture is not a golfer elbow, it's another kind of pain. It's not an inflammation of the tendon. It will be another kind of pain. You have a fracture here, again, some part of the neck, because the nerve that goes to the arm comes from here. The neck will stuck, twist, and you can start having pain everywhere. Maybe on the opposite shoulder, maybe on the lumbar spine. Maybe you will put more pressure on the left side and you will start to have a plantar fasciitis, okay? Start widening a little bit more your understanding and start doing tests on yourself. So you can try to do tests very simple, like a rotation of the neck. And you may notice that there is a difference, especially if someone look at you, especially if you have a mirror in front of you. Try to bend the neck. Sometimes to bend your neck, you compensate, you move your shoulder. How many people have one shoulder forward? How many people has been told your pelvis is misaligned, you have a shorter leg? Shorter leg almost do not exist. Only if you have a big fracture or if you have a congenital problem, so you were born with some trouble, okay? It doesn't exist, but if you check only on the foot always appear like that. Why? because for any injury that you accumulate in your life, your body in general, tend to twist. The pelvis twist and the leg twist. So if you combine the foot, they always feel different. This is a main thing that everyone tells patients. I don't know why. You have a shorter leg. It doesn't exist. Don't tell these things. You don't need an insult. Okay? You need a proper assessment to understand how to readjust your body. It's not true that if you have a pain, you have a muscle weakness. Sometimes people come to me with a shoulder pain and they say, maybe because I carry the bag always here, but if you carry the bag always on this shoulder, you should be strong. So there are a lot of things that doesn't make any sense, okay? Let's not move you from a chronic pain to a chronic treatment. You don't need a chronic treatment. The treatment has to be very precise, spot on the place, which makes sense. And I will make sense of what's going on because I will let you feel the restriction. Especially in the UK, therapists tend not to touch a lot, except the one that crack your bone. The problem with crack your bone is extremely hard to do it. You know if it was successful, if the problem doesn't return. So if you need to go crack your bone and then again crack your bone and then again crack your bone, okay, if I crack my finger, okay, now they move more. In 10 minutes, they will return to the previous stage and I will be able to crack them again. What did happen? Not much, okay? So the important is make sense of what's going on. Your lumbar spine pain or your neck pain, your headache, your period menstrual pain, your plantar fasciitis or whatever it is your own one. So there is a reason that is yours. If you have a knee pain, you just lie and you ask someone to grab your leg. You can grab your leg over and above the knee and just try to twist. Ask someone to twist one way and the other, and then compare with the other knee that is not painful. You will see the painful one, it goes a lot one way, it doesn't go at all the other way. Whilst the other one goes a little bit more on one side than the other, are more balanced. Where this imbalance come from? Pelvis operation, appendix, fracture on the arm, operation on the eyes, misalignment on the jaw because you had an implant, who knows? But just forget that the pain comes from the painful spot, okay? For any question, drop me an email. I will try to give you some advice, but definitely you never tried what I proposed in you before. It's very unusual, my kind of treatment, because everyone is focused on the painful spot. Just come, I will definitely surprise you with my ability. Thanks for watching.